Today I'm going to talk about muscle tightness, specifically calf tightness. So first thing I wanted to do is go over a little bit of anatomy, and the anatomy of the calf pretty much consists of two muscles. There's an inner muscle called the soleus, and then there's the outer thicker muscle called the gastrocnemius, or gastroc for short. Both of these muscles make up the majority of the back of the leg, the lower leg, which is the calf, and those muscles then become driven to one into the Achilles tendon, and then the Achilles tendon goes into the back of your heel known as the calcaneus. Now more specifically, what are the differences between those two muscles? Well, the soleus, which is the deeper muscle, it starts in that calf area and goes down to your ankle. However, the gastrocnemius or gastroc, the outer muscle, is a big muscle, has two different heads to it, two parts. It crosses your knee and your ankle, so it's actually considered a two-joint muscle. What are the functions of your calf? So it helps with plantar flexion, which means pointing of your foot down, and it helps with propulsion because of that reason. So if you're participating in a sport or you're pushing off of your toes or your forefoot, those muscles are in charge of doing that. Also provides ankle stability when you are walking, running, or jumping. So calf tightness, how does that happen? Pretty commonly it happens with anybody who's participating in exercises or running any kind of cardio without warming up. So pretty much you're just going right into the activity. You're not taking the time to set your muscles up for success in a sense. So you're not taking time to warm up those muscles to get them prepared for fitness. So what kinds of symptoms for tight calves? Just normal tightness, just feeling like you can't stretch it out. Cramping is another one, especially if you're performing activities and not hydrating enough. So if you're not stretching and you're performing a lot of exercise, whether it's running or sports, and you're not drinking the proper amount of water, then you are going to have a lot of cramping going on in that muscle because it needs fluid in order to keep at a lengthened state. The other thing is difficulty standing on your tiptoes. When you're trying to go up on your toes, you will notice that you might not have the strength to be able to do that, or it'll automatically cramp up when you try to do that. Difficulty straightening the knee, and that's in relationship to the fact that that outer calf muscle crosses the knee. So you might notice that you may start walking with a slight bend in your knee, or you might notice that when you go up and down stairs and you're pushing off that back leg, to come up, you might notice that you're having buckling at the knee. So that's all in relationship to having some tightness in the calf. And then also if you're just walking and you're trying to put the heel down, so when we walk, we do something called a heel strike, and that is whatever leg is coming forward towards the ground, the heel is technically supposed to come down first before you put weight through your foot. So if you are having some tightness in your calf, you might notice that you're not actually able to do a good heel strike by putting that heel down first. You might come down foot flat, and then also pushing off might be an issue as well when you're trying to push that foot off from behind when you're coming through. So all those things are in relationship to having tight calf. So how to prevent tight calf muscles? Obviously stretching is very important. If you're participating in any sport or you're just running or any exercise program, you should always have a 5 to 10 minute warm up, which involves dynamic movements to prepare the muscles for exercise. But after you're done the exercise or running or anything like that, you should do static stretching, which involves holding the muscle in a lengthened position for at least 20 to 30 seconds, about 3 reps on each side. And that's going to help relax the muscle so that it can then elongate into a new normal state. The other thing is checking out your shoe wear. If you notice that you've had the same pair of sneakers for a long period of time and you're wearing down the soles, then obviously they're not performing at the most optimal that they are supposed to be performing in, so you could need new shoes, which would then help as far as proper stability. If you're wearing too many flip-flops or high heels, you're not getting that good ankle support, and you're also causing a shortened, like I said, tendon in the back, the Achilles. That's something to be wary about. Make sure if you're gonna wear high heels or flip-flops, although not recommended for long hours during the day, you're trying to alternate with other shoe wear so that your calf muscle doesn't get too tight because of that. The other thing is overall fitness, addressing muscle imbalances, so trying to strengthen the muscles up at the core and the hip, as well as with the stretching program, and then everything will be balanced out so that you don't have other muscles compensating for the tight and weaker ones like your calf. Finally, physical therapy is an awesome option if you're noticing that you don't really know what to do and you're participating in sports, or you're just running or participating in your own exercise program, and you're having pain. The best thing to do is go to a physical therapist, because we can actually evaluate the problem and determine where the origination of the problem is coming from. So like I said, you might have tight calves, but is your glutes and your core up here, are they too weak, and we need to address that. The other thing is we can help with fitting you or suggesting proper shoe wear. A lot of people will go to get their own sneakers and not pick the correct sneakers for their support. So we can assess your actual foot and ankle, tell you what is the proper shoe wear, and then have you go ahead and go get those. Also, we can assess your gait. We can watch how you run. If you're not having good form, we can address that and teach you how to then improve your form. And then also we provide some manual treatment to you to decrease tightness in the calf, increase blood flow and circulation, to help with that stretching component. And the biggest thing is obviously the home exercise program. We can give you the tools to be able to help handle that during your time in physical therapy, but more importantly, to make sure you have the tools to be able to handle that after you're done. So if you're interested in looking more into having a physical therapist check you out if you're having pain, we would love for you to come in for an evaluation. Just click the link below and we can get you set up for one as soon as possible.